Hi, I'm Dr. David Greene, CEO of Preferred Pain Center here in Phoenix and Scottsdale, Arizona. Today I'm out in front of one of Phoenix points of pride, and it's called the Tovrea Castle. It was built back in 1928 by an Italian immigrant named Alessio Carrero. Alessio sold it 2 years later to the Tovrea family, so now it's called the Tovrea Castle at Carrero Heights. The castle is absolutely gorgeous, and it looks like a three-tiered wedding cake. So a lot of people in Phoenix call it the Wedding Cake Castle. It's very prominent off of one of the major freeways around the city called the Loop 202. And basically it's got a bunch of land around it, and it sits up on this hill here. And right now it's under renovation. It used to have 200 and some acres around it that Carrero owned. And over the years that got sold off, and the city started to purchase some back. They have about 40 acres around it. A lot of lush desert landscape around here. It used to be much more intense, but after the Tovrea family kind of died off and the estate took it over, it fell into decline, as a lot of large estates do, and the city purchased it back in the 1990s, and as of the last few years they've been renovating it nicely, and it looks much, much better. The topic for today is chiropractic treatment in the current state of affairs. When a lot of people think of chiropractors and what they do for patients, they don't realize the breadth of treatments that chiropractors offer. They think patients go in, they get their back cracked, and then they just kind of say goodbye. Well, for the vast majority of chiropractors in this country, they do so much more than that, and a lot of people don't realize that. It's a shame because chiropractic treatment now is very mainstream. Insurance companies are covering it. More and more and more patients are seeking the care of chiropractors. At any one point in time, over 10% of the U.S. population is under the care of a chiropractor. Chiropractors don't become so by taking a weekend course and then hanging out a shingle. They complete college, and they go to school for another 4 years at an accredited institution in this country to get their degree, to become doctors. Now, in my book, there are two different types of chiropractors. There's the medically inclined chiropractors who do more of the physical therapy types of treatment along with the chiropractic and other treatments to help patients. Then there's the chiropractors who feel like chiropractic treatment can cure cancer and those types of outlandish types of things. So the chiropractors that we have at Preferred Pain Center are medically inclined chiropractors. One of them, Dr. Sky Moore, was recently named Best Chiropractor in Phoenix 2010. Very skilled, been in practice for 15 years. The treatment that a lot of chiropractors, including ours, are able to provide includes, as we know, spinal adjustments. Those have been shown in numerous research studies to be extremely effective in the acute care of low back pain. There's some studies backing them up for neck pain as well. And they can help patients avoid surgery, get back to action quicker after an acute low back injury. Other things, physical rehabilitation, which is lumbar strengthening, stabilization, core strengthening and stabilization, neck exercises, basically physical therapy type exercises that are part and parcel of getting patients better and keeping them better. Giving patients a home program so that they don't have these accidents keep happening over and over again with their back going out or their neck being a problem. Another part and parcel of what chiropractors are able to do and what they do at Preferred Pain Center is spinal decompression therapy. Spinal decompression was FDA cleared back in 1996, and since then has grown in popularity because A, a full treatment costs less than 5% the cost of spinal surgery. B, a growing body of research is showing that it can be very effective for the non-operative treatment of low back pain and neck pain. And C, it's virtually no risk. Very minimal risk. A lot of patients fall asleep on the chair, on the table, and it is non-operative and mostly very comfortable for patients and very effective. Another point about chiropractic treatment, as I mentioned, is that insurance companies cover more and more of those treatments. And at Preferred Pain Center, if we have a patient who's self-pay or benefits don't cover it, we make it unbelievably affordable such that you may be able to come in for just the cost of a copay on any given day. So those are things about chiropractic treatment in this country. It is becoming more and more mainstream and much effective as compared to some of the other treatments that are in existence. And with the combination of things that are available, such as at Preferred Pain Center, there's a very high satisfaction rate. Chiropractic care in and of itself has an 87% satisfaction rate. When you combine the other things that we do, we're talking up in the 95 to 98% effectiveness rate. It can help decrease the amount of medications that patients are taking, decrease the lost days from work, and also increase a patient's social life and recreational ability. So call us today at 602-507-6550. Also visit us on the web at www.preferredpaincenter.com and also preferredpaincenter.com/blog for the blog of pain. I'm Dr. David Greene, Preferred Pain Center. The pain stops here.